Welcome back to the Governor's Institute's Addiction Medicine podcast. I'm Pauline Williamson, Director of Physician and Advanced Practice Provider Initiatives at the Governor's Institute. I'm excited for today's conversation with Dr. Michael Baca-Atlas. He's the immediate past president of the North Carolina Society of Addiction Medicine, and he wears many hats and brings a wealth of experience to our conversation. I invite our listeners to learn more about his background in the show notes. Today, we're kicking off a new series focused on hot topics related to substance use disorders. In each episode, we'll take a closer look at an important clinical issue and highlight 3 key takeaways you can put into practice. Today's hot topic, GLP-1s. Everyone's talking about them. Everyone has questions. So let's get into it. Thanks for being here, Michael.
Paulin, thank you so much for having me. And it's really nice for us to get to spend some time together outside of our kind of conference, addiction medicine conference duties that we do together. And I'm just super excited for the conversation because it is an exciting topic.
Absolutely. So why? Why this topic? Why now?
Well, I don't think either one of us is living under a rock. And so it's almost impossible to not come across hearing about GLP-1s and some of their different iterations that have come out, some newer versions and updated medications. But really in the last few years, we have seen tremendous growth in the amount of literature that we're seeing around substance use disorders. And mostly that's looking at alcohol, tobacco, and some more emerging research around opioids. But it's really exciting because I think at the end of the day, when you're working in addiction medicine spaces, at least from a pharmacotherapy perspective, we've sort of been relatively stagnant in the last few decades. Different versions of buprenorphine and some other medications, but just having extra tools in the toolkit potentially is really exciting to think about when doing this work.
So what are some things that clinicians need to consider when they're thinking about GLP-1s in their patients?
I think first and foremost, Paulin, right off the bat, I want to be very clear that none of the substance use disorders that we talk about have an FDA-approved indication for these medications. So right off the bat, there are no FDA-approved GLP-1s for tobacco, alcohol, opioid stimulants, et cetera, et cetera. So I think very important for clinicians to be aware of, although there is a lot of buzz and excitement about the literature, particularly there's a lot of observational trials and emerging randomized controlled trials in this space, particularly for things like alcohol. We just, I think, have to kind of hit the pause button initially just to say that they're not FDA approved. There's still growing evidence in this space, but still really exciting.
So let's break this down. We promised the listeners that we would give them 3 key takeaways. So what is your first takeaway when it comes to GLP-1s?
Paulin, takeaway number 1 is just regarding the evidence that we have around GLP-1s. And I just wanted to share a couple things that I think listeners can use when they are talking to their patients. So really exciting. Back in March of 2026, there was a really interesting trial, over 600,000 patients, an observational trial that came actually looking at veterans, and they looked at GLP-1 receptor agonists and risk of substance use disorder. What was really interesting is those that had initiated this medication actually had associated lower rates of new alcohol, cannabis, cocaine, nicotine, and opioid use disorders. And among those with pre-existing substance use disorders, we saw fewer overdoses, acute care visits, and fewer deaths. And so although, Paulin, this is an observational signal, and I think that's always important when you're examining the literature and looking at evidence in general, it's still really exciting to see that we're seeing this really impact a number of different things, new initiation, potentially things like overdose. And some of that data has been replicated in other studies. So we're not even talking about things like craving or reductions in use necessarily like at an individual level, but looking at this very large population of individuals, really seeing signal towards reductions in use and also outcomes that we really care about, which are overdose deaths. And obviously in the last few years, it's been exciting to see kind of the downturn in opioid overdose deaths, but still those numbers are way too high.
And I feel like this is what patients are coming in. They've heard buzz on the internet. They're on their Reddit threads. They're seeing information about this potentially helping them. I'm sure they come in really hopeful that this is ready to go and ready for prime time. What do you say to those patients that are like, hey, I heard GLP-1s can fix my problems? What do you say to them?
Well, and I say you're absolutely right that there's some growing evidence and there's things that we know. And, you know, if there is another reason that you may benefit from a GLP-1, that sort of as a primary care clinician myself, I'm seeing patients who might benefit for kidney protection or cardiovascular disease reduction or weight management because their arthritis is really bad in their knees or other places. And so if there are opportunities to kind of double dip a little bit or triple dip, when we have someone who would really benefit across the board and they might get some extra benefit with their alcohol use or tobacco use or their opioid use, I think that could potentially be really powerful. So I say, first and foremost, we need to look at, do you have a FDA-approved indication for a GLP-1? Are you a good candidate? We need to look at risk, benefits, side effects, all the things that we would do for any other medication that we use. And then really making sure that we're paying attention to that substance use. And if they do start a GLP-1, seeing the evolution and potential change in things like craving and use. I see a lot of my patients who very kind of interestingly enough come in because we started it for a pretty serious medical condition other than substance use disorder like weight management or cardiovascular disease. And they say, oh yeah, by the way, I just, those 8 beers that I was consuming a day, it's down to 0. And we kind of have this like aha moment and celebrate together, which is really beautiful. But right, that wasn't the initial intention. It sort of just happened. And again, a lot of the literature and evidence that we have really speaks to that.
So obviously there's a lot that's still being discovered, still under research. We're going to stay tuned to that. So curious, what is your second takeaway for our providers?
This is critical for addiction medicine clinicians. And to me, it's like, it doesn't matter if you're going to ever prescribe these or not, right? But give you a perfect example, Pollen, is that we know that one of the biggest issues, relevant side effects for GLP-1s are kind of gastrointestinal or GI. So that includes things like nausea, vomiting, diarrhea, and particularly my favorite is constipation. Love talking about constipation in clinic. Very popular topic in the work that I do. But right, we see a lot of people who already at baseline, let's just focus on opioids for a second, that have issues with constipation, nausea related to that. You as a clinician, if you are not aware that they have started taking a GLP-1, again, 1 in 8 adults in the United States are using these medications, you may think that, we need to lower their dose. This is their opioid that's at work, that's at play, that's causing these issues, and potentially could destabilize someone who's been doing really well regarding management of their opioid use disorder from the get-go. So those GI side effects are really critical. I think other side effects that addiction medicine clinicians need to be aware of, we actually think that there's less pancreatitis risk than originally was sort of borne out in conversations and some literature. But I especially think of that for people who use alcohol. That is something to counsel people about and for people to be aware of. The other one that I see come up a lot more is actually gallbladder disease and biliary disease. So people coming in with right upper quadrant pain and, initially you might think, it's just their constipation or their gut has slowed down a little bit, but actually GLP-1s can have a pretty big impact on that. The one thing that I really relay to a lot of my addiction medicine clinicians, especially like my psychiatry colleagues that are doing addiction medicine or addiction psychiatrists or just psychiatrists in general, is that the evidence really does not support mood or increased sort of mood disturbance or suicidal ideation. And so the FDA in March of 2026 actually put out a statement about that. So I anecdotally do still hear that from time to time, but it isn't necessarily a part of my general counseling for people. If they do have something like schizophrenia or bipolar disorder, probably maybe a little bit more likely to mention just if you have a change in your mood, something to bring up. But understanding as addiction medicine providers the side effect profile of these agents, we really need to be incorporating that into our own education so that we have awareness, especially when our patients aren't maybe telling us that they're taking it, and obviously that maybe they're getting it from a different clinician.
Yeah, it definitely seems like something a patient might not even think to bring up if they're seeing you separate from their primary care provider. All right, so third takeaway, what do we want folks to know?
I think as addiction medicine clinicians, right, even though if you're not necessarily doing their primary care or, totally responsible for their psychiatric care or kind of other things, I think that it's really critical to understand and think about GLP-1s in sort of the way that we think about kind of whole person care for our patients with substance use disorder. And so one thing that I think addiction medicine clinicians should be aware of and hasn't probably gotten enough attention is really being thoughtful in screening for disordered eating or eating disorders. And what are some of the reasons that someone might start a GLP-1, whether that's something that is compounded, that they've bought online, you're noticing weight loss. I think that I always talk to my trainees that I work with just about the importance of just, vital signs. Looking at particularly weight and substance use is really critical. Both weight gain can sometimes be a sign of maybe mental health destabilization, but also tremendous weight loss. We always think about, obviously, in older adults, things like cancer or malignancy, but maybe they've started using a stimulant or again, are they on a GLP-1 and they're having pretty profound weight loss? And maybe we don't know where that GLP-1 is coming from. It's from an online source, which those can be somewhat problematic in the way that they're processed and shipped and stored. So I always counsel patients about that, but just making sure that we're really screening for maybe some of those negative side effects that are maybe desired by some individuals to make sure that we are not contributing to problems and sort of further promoting issues related to, again, both like in that eating disorder space, I think is really critical as we see and continue to see more and more patients who are taking these medications and utilizing them.
So lots of things to consider when it comes to GLP-1s and providing care for any patients, and certainly patients who might have a substance use disorder. So if a clinician listening today could change one thing about their practice based on our conversation, what would you want that to be?
I think it would be twofold. I think it would be to be open to the conversation if someone brings up GLP-1s to you, to present the evidence that they are not FDA approved, but also in order to be a part of this conversation, you have to have a better understanding of these medicines. Obviously, they're not FDA approved yet, but it seems likely that that probably will happen probably in the future. And so we all need to have a better understanding of, the side effect profiles, how this kind of intercepts, how this interacts with some of the different substances, whether that's ongoing use of a substance or potentially like a withdrawal state or even long-term maintenance of a substance use disorder. That's just stuff that we kind of have to, I think, have a better understanding of, even if we're not the ones prescribing.
Makes sense to me. So what would you suggest as a resource for clinicians to learn more about this topic?
Paulin, you're going to love this one. Are you ready?
I bet I will.
So if you come as listeners to some of our educational sessions at things like our Addiction Medicine Essentials Conference in the fall and our Addiction Med Conference in the spring, these are great places where we're really starting to bring more of this material to light and to, as updates are presented, obviously, we want to make sure that, we have some newer information to present, but, every 6 to 12 months, there's a lot that changes. There are a slew of new GLP-1s that are going to be released in the next probably year or two. And we want to make sure that from an addiction medicine education standpoint, that we continue to put out material that just cues you as an addiction medicine specialist to know kind of the names of some of these agents as people are coming in and talking to you about them, but also some of the updated literature as it pertains to substance use.
Yeah, I suspect that our next few conference agendas will have this topic on the agenda as far as an update is concerned. So I know for the listeners, if you are interested in coming to one of our addiction medicine conferences, you can find all the details at addiction-medicine.org.
Addiction medicine clinicians just have to be a part of this conversation, particularly around this class of medicines as a whole. I think it's really opening up some interesting doors and some innovation in the field.
And starting some interesting conversations between providers and their patients.
100%.
How these could maximize recovery. I think it's always something to keep in the back of our heads. So, Michael, thank you so much for joining us and sharing your expertise today. Before I let you go, do you have any final words for clinicians caring for patients with substance use disorders, GLP-1 related or not? Final thoughts?
Final thoughts is whenever somebody brings me in something like, hey, I want to start this GLP-1, I think that there is a sort of case to say, we're not going to talk about that or we're not going to do that. And I think I always, whenever patients bring up stuff to me, whether it's really far out in left field or maybe that's not something that I would recommend, I always just start by saying, thank you so much for being invested in your health, in your well-being. And, I think it would make some sense for us to talk about some of these things today, but never really just kind of poo-pooing or putting down an idea or a suggestion. And especially as clinicians out there, that if you're not as familiar with some of this, I think it's perfectly fine to say to patients too, let me go look at this, or let me look into this a little bit and I'll get back to you. I can't tell you how many times that I do that every single day to the patients that I serve and work with is, you know what, I don't know all the information. Let me go either find someone or look up some information. And I think particularly because this is such a relatively new topic and relatively new space in addiction medicine, we just sort of, really needing to be open and also understanding our patients, understanding what they're looking for, why they're asking these questions, and supporting them along their journey.
Thank you so much for being here, Michael, and thank you for all of the work you do in the addiction medicine space. We hope today's conversation gave you practical information that you can take directly into your clinical practice. We'll be back soon with another timely topic and more takeaways. Thanks for listening.
Addiction Medicine Essentials starts the conversation. The Addiction Medicine Conference takes it further. Join us virtually for Addiction Medicine Essentials on October 16th and 17th, 2026. Practical, foundational training designed for professionals across healthcare, behavioral health, and community support systems. Gain real-world tools, fresh perspectives, and strategies you can put to work immediately. Then, join us in Raleigh, North Carolina for the Addiction Medicine Conference, March 18th through the 20th, 2027. North Carolina's premier gathering for clinicians, leaders, and changemakers advancing addiction care across the region. 2 experiences, 1 mission: better care, stronger systems, and healthier communities. Start online, continue in Raleigh. Addiction Medicine Essentials and the Addiction Medicine Conference. Be a part of what's next. Learn more and register at addiction-medicine.org.